In 2021, the Australian Refugee Association ARA collaborated with the Burmese Chin, Burundian, Congolese, Pashtun and Syrian communities to increase COVID-19 vaccination rates. Low vaccination rates in these communities meant they would be significantly at risk when the South Australian border reopened that December. Many people were getting false information from social media because it was the easiest way to find vaccination information in their language. To counteract this, ARA produced a series of videos in different languages to provide accurate information about COVID-19 vaccination. In each video, a community member and a doctor or nurse explained the importance of COVID-19 vaccination, how the vaccines were developed, the safety of the vaccines, and how to manage the side effects of the vaccines. The videos also showed a step-by-step demonstration of a vaccination appointment. People were encouraged to get vaccinated through an SA health clinic, their GP or ARA pop-up vaccination clinics. ARA clinics had a culturally appropriate setting with female clinic staff, translators, and private vaccination rooms. Through this project, the videos reached more than 3,000 people and the ARA clinics administered 249 doses.